Dolly Parton recently took to social media telling her fans in this video that she is A-OK, but she's been dealing with some problems. She's been undergoing a few treatments as well. She had to postpone that Vegas show. She admitted she's been dealing with kidney stones after her sister asked the public to pray for her. She later apologized after making Parton's fans very concerned. The sister apologized. Joining us now is a nephrologist from Endeavor Health, Dr. Ashwin Shetty. Good morning, doctor.
Hey, good morning. Thanks for having me.
You know, any excuse to talk about kidney stones. I'm sure it has to be so painful. I can't imagine. How would you describe what Dolly Parton is going through?
So, stones can vary, but a lot of times you can get what's called like flank pain, depending on where the stone is and how large the stone is. But you can get pain in your side, and sometimes that can be episodic, meaning that the pain comes and goes. And it can radiate based on the size, based on the location. And sometimes that pain can go down into your groin. So pretty much a lot of times it can be pretty painful.
Is this a pretty persistent problem? Like if you're diagnosed with it, you're going to have recurrences throughout your life?
So, about 10% of patients get kidney stones at some point in their life. So it's not totally uncommon. But if you get one kidney stone, you got about a 50% chance of getting another stone at about 5 to 7 years later. So yes, it could persist if you have it.
When do they usually appear? Are children getting these, or is it more adults?
More adults, yeah. It's pretty uncommon to get it as a child, and if as a child you have to do a lot more testing on it. But as an adult, if you have one stone, it's not a huge deal. But if you get a recurrent stone, then you definitely need a workup to see what's going on. And
what is the treatment for a stone?
So really, drink. You got to drink a lot of water. We tell people to drink about 2.5 liters of water a day, and that really kind of flushes out the stone. Other little things like a low salt diet can help. There are foods that are called oxalate foods. Some of them are like nuts and coffee, chocolate, some foods that people like, we tend to avoid. But those are kind of the big dietary things that we can do for stones.
Let's dive into some of the myths about getting these. For example, some people in the newsroom say that they heard drinking a lot of powdered drinks can cause these. Is that true?
So not so much. It's really like the fluid content that's the most important. So as long as you're drinking a lot of fluid, there are certain fluids like coffee, which has a lot of oxalate, which might not be as good of a something to drink. But no, powdered drinks by themselves, I wouldn't be concerned about that.
So where might you see pain originate from in your body that might tip you off that you have one?
So sometimes it can even start just as a little bit of nausea and abdominal discomfort, but the pain sometimes is in your flanks, so right in your back area, and then that can radiate down to the groin, and that's where you get a little bit more concerned about it, especially in the lower abdomen and then kind of radiating down.
And then when you have this type of pain, I'm assuming you should probably make a doctor's appointment right away?
Yeah, so like, the hard part is that sometimes it's very general, right? But if it gets more intense, then definitely you should see a doctor. Drinking a lot of water can help at home. Little things like ibuprofen or Advil just to help with the pain can also help. But if this persists for a couple of weeks, for sure, you should definitely go in to see a doctor.
I love free medical advice. Thank you so much, Dr. Shetty. We appreciate your time this morning.
No problem. Thanks so much.